Jason? Jason, are you all right?
Yeah, I think so. I didn't see you coming.
Are you hurting?
No. More surprised than anything else.
A significant blow can create injury and bleeding inside the body. This is especially true for organs in the chest and abdomen. Internal bleeding can be difficult to detect. Suspect it if the chest or abdomen is hit hard. Signs of shock may be the earliest indication that internal bleeding is occurring. Shock develops when poor blood flow creates a shortage of oxygen to body tissues. Any serious illness or injury has the potential to cause shock. If not treated early, it can get worse and become life-threatening. Shock is progressive in nature. Early signs can be difficult to detect. A person may simply appear uneasy, restless, or worried. Other more serious signs can emerge gradually over time. Responsiveness may diminish. The skin may become pale, cool, and sweaty. A person in shock must get to a hospital as quickly as possible in order to survive. Early recognition, treatment, and activation of EMS are essential for survival. To limit the effects of shock, help the body maintain adequate oxygen by ensuring an open and clear airway, ensuring normal breathing, and controlling any external bleeding. If there is no difficulty in breathing, lay the person flat on the ground. Maintain a normal body temperature. Insulate on top and underneath to prevent heat loss. Be careful not to overheat. Give nothing to eat or drink, even if the person asks for it. Keep the person as comfortable and calm as possible. Reassess regularly until another provider or EMS take over.
When the body suffers a significant force, such as from a high fall, shooting, or motor vehicle crash, serious injury can result, most notably to the spine. Injury to the spinal cord can result in temporary or permanent paralysis or in a life-threatening condition, such as the loss of breathing. After the initial injury, movement of the damaged spinal bones can result in additional injury to the spinal cord or surrounding tissue. This can result in permanent damage. Always make sure it is safe to provide care. Quickly instruct a responsive person to remain still. Ask about how the injury occurred. Look for any obvious injury to the head, neck, or back. Ask about numbness, tingling, burning, or loss of sensation in the arms or legs. The lack of obvious injury does not mean that the spine is not injured. If a significant mechanism of injury occurred, it is best to assume a spinal injury exists. The priority of care is to help prevent further injury by keeping the injured person still and using spinal motion restriction. Activate EMS. Comfort, calm, and reassure the person. Reassess regularly until another provider or EMS take over. To perform spinal motion restriction, get into a comfortable position behind the person. Cup your hands on both sides of the head without covering the ears to manually stabilize it. Minimize any motion of head, neck, and back. Establishing an airway for an unresponsive person is a higher priority than protecting suspected injury to the spine. Tilt the head and lift the chin when it is necessary to maintain an open airway or give rescue breaths. If you need to leave an unresponsive person with a suspected spinal injury alone to get help, place the person in a recovery position to protect the airway before you go. Bones, muscles, and joints give the body shape, allow movement, and protect vital internal organs. Long bones form the upper and lower parts of each limb. Muscles, ligaments, and tendons attach to the bones, allowing for movement where the bones come together at joints. These bones are the most exposed to external forces and injury. There are 4 different types of injuries affecting bones, muscles, and joints. Strains are stretching or tearing injuries to muscles or tendons. Sprains are tearing injuries to ligaments that hold joints together. Dislocations are the separation of bone ends at a joint. Fractures are breaks in bones. Common signs of these injuries include swelling, pain, and discoloration. Distinguishing an injury to muscle or bone is often difficult. It is best to treat them all as possible fractures.
Somebody! I need some help. I'm in the stairwell.
The limb may appear deformed, and the person may be guarding it by holding it against his body.
What's wrong?
My shoulder. I felt it pop. It's bad.
Okay, we can help. Just hold it still. Josh.
Unstable bones or joints can damage tissue, muscle, blood vessels, and nerves when moved.
Just hold it still.
The immediate treatment is to minimize movement and prevent additional injury. If the injury seems serious or you are not sure, activate EMS as early as possible. Encourage the person to not use the injured limb. Movement can cause further injury. An open wound may be present in association with a fracture. If needed, expose the injury site by gently cutting or tearing away clothing. Cover an open wound with a clean, absorbent pad and gently control bleeding with firm, continuous, direct pressure around the bone or injury site. Never push a bone back under the skin. Leave the injured limb in the position it was found. Use padding in the gaps and holes underneath it to provide a stable and comfortable spot for the limb to rest. If needed, place your hands above and below the injured area to help immobilize the limb. For many injuries, local cooling can help decrease bleeding, swelling, and pain. A plastic bag filled with a mixture of ice and water works best. Place a thin cloth between the bag and skin to prevent cold-related problems. Limit application to 20 minutes or less. Comfort, calm, and reassure the person. Reassess the person and the injury regularly until EMS arrives. Splinting an injured limb can reduce pain and prevent further injury. In general, it is best to rely on EMS personnel to splint, as they have more extensive training, experience, and equipment.
Burns can inflict serious physical damage to the body. Typically caused by close exposure to high temperatures, chemical reactions, or electrical current, burns can vary in severity. The larger the surface area burned, the greater the disruption of the skin's ability to properly maintain body temperature. The deeper a burn goes into the skin and underlying tissue, the more likely the risk of infection. Burns involving the face, hands, genitals, and feet can result in the limitation of basic functions, such as movement and sensation.
Devin, get on the ground and roll on it.
Minor burns include those that involve the outer layer of the skin and result in redness and pain. These include small burns that extend into the deeper layers of the skin and cause some blistering. Cool the burn with cool water as soon as possible. Continue cooling until the pain is relieved. This will reduce pain, swelling, and the depth of injury. Leave any blisters intact. Cover the burn with a loose, sterile pad. Minor burns usually heal without further treatment. Deep burns over a large area of the body are the most severe. These burns often result in extensive blistering and destruction of skin tissue. Make sure the situation is safe for you to help. Activate EMS immediately. Expose the affected area by cutting or tearing away clothing. If any clothing is stuck to the burn, do not remove it. If present, remove any jewelry near the burned area. Separate fingers or toes with dry, sterile, non-adhesive dressings. Do not apply butter, ointment, lotion, or antiseptic. Loosely cover the burn area with a dry, clean pad or clean sheet. Give the person nothing to eat or drink. While awaiting EMS, monitor the airway for swelling from inhalation of smoke or hot gases.
Can't get it.
Here, let me try.
Some chemicals can react and damage skin tissue on contact. The immediate care is to dilute and remove the chemical quickly to minimize the damage. Remove any contaminated clothing. Flood the affected area with large amounts of water, unless the chemical is known to react with water. Continue to flush with water until the burning sensation stops. Cover any visible burns loosely with a dry, clean pad and seek further medical attention. When involved, brush off any dry powder with a gloved hand or cloth prior to flushing.
Hey honey, can you give me a hand for a second? This washer's leaking. I need help moving the dryer.
Electrical burns are caused by contact with electrical wires, current, or lightning. Be safe. Turn the power off before touching the affected person. If you cannot make it safe, do not attempt care. An electric shock can cause an abnormal heart rhythm in which the heart stops. Perform CPR until an AED is ready, another provider or EMS personnel take over, or you are too tired to continue.
Darby?
Jeannie. You all right? Here. Sit down. Right here.
Medical conditions and illnesses can suddenly trigger an unexpected medical emergency. In general, suspect a serious illness when, without warning, a person suddenly appears weak, ill, or in severe pain. In many cases, the human body displays warning signs to alert us to serious illness. The most common warning signs of serious illness are altered mental status, breathing difficulty or shortness of breath, pain, severe pressure, or discomfort in the chest, and severe abdominal pain. Caused by a number of medical conditions, an altered mental status is a significant or unusual change in a person's personality, behavior, or consciousness. It is an indication of a change in brain function.
Hey, Mike, heard you were looking for me. Mike? Mike, are you okay? Mike? Mike, it's Scott. Do you understand me?
Regardless of the cause, an altered mental status is a warning sign of a serious problem and is considered a medical emergency.
Hey, Taj, can you come here, please? Just relax. We're gonna take care of you.
What's up?
He's confused. I'm not sure what it is. Can you please call EMS?
Sure.
Activate EMS. Position the person for comfort. Calm and reassure the person as best you can. If the person's level of responsiveness is or becomes severely diminished, consider placing the person in a recovery position to protect the airway. Reassess regularly until another provider or EMS personnel take over.
Here you are.
Thank you. Anne, what happened? What's the matter? Can you hear me, Anne?
Hi, my name's Andy. I'm trained in first aid. Can I help?
I don't know what's going on. She's just not responding.
Can you understand me? Okay.
A stroke or brain attack occurs when the blood supply to a portion of the brain is suddenly interrupted. This most commonly occurs when a blood clot gets caught in a blood vessel. A stroke can also occur when a weak spot in the wall of a blood vessel, known as an aneurysm, bursts open and bleeds into the surrounding brain tissue. In both cases, brain cells die. Signs of a stroke can vary. They tend to show up suddenly. Numbness or weakness of the face, arm, or leg, especially on one side of the body, may be present. A person may appear confused. A change in the ability to speak or understand can occur. Sight and balance can be affected, and a severe, sudden headache may be described. A quick method to determine if someone could be suffering from a stroke is to ask the person to smile, to hold up both arms, and to speak a simple sentence. If the person has trouble with any of these tasks, a stroke may have occurred.
Do you have a cell phone?
Yes, I do.
Can you call 911?
Sure.
A stroke is a true medical emergency. Activate EMS immediately if a stroke is suspected. Rapid treatment in a hospital is critical in limiting the damage that can occur. A person experiencing a stroke can become frustrated at being unable to move or communicate clearly. The person may appear confused but still be aware of what is happening. Calm, comfort, and reassure the person until another provider or EMS personnel take over. Do not give anything to eat or drink.
Scott? Scott? Are you okay? Scott, what's wrong? I came to have lunch with Scott and something's wrong.
Okay, let me see if I can help. Scott? It's Nina. We're worried about you. Can I help?
Nina? Hi.
Scott, do you know what's happening?
Diabetes is a disease in which the body cannot effectively use sugar for energy. Suspect the possibility of a diabetic emergency with anyone who has a gradual change in mental status. The skin may be pale, cool, and sweaty. You may also notice a sweet or fruity smell in the person's breath. If a person is diabetic, there may be evidence of the condition. Ask others about the person's medical history or medications he may be taking. Look for a medical alert bracelet or necklace identifying the condition.
His bracelet says that he's diabetic. Go to the refrigerator in the break room and get some juice.
Okay.
If you know the person is diabetic, determine his level of response and ability to swallow. If the person is responsive and able to swallow without difficulty, give sweet juice, candy, or any sweet substance containing sugar. If the person has oral glucose gel, use that instead. Do not use anything with an artificial sweetener. If the person has a diminished level of responsiveness and has difficulty swallowing, activate EMS. Do not give anything to eat or drink. Calm, comfort, and reassure the person. If he responds to the sugar, his mental status will gradually improve. If there is no response to sugar within about 15 minutes or the condition worsens, activate EMS. It is important to note that insulin is not considered an emergency medication. It is never appropriate to administer insulin to a diabetic person in an emergency setting.
Jack, what's wrong?
Seizures are triggered by excessive electrical activity within the brain. The result is uncontrolled muscle convulsions throughout the body. Generally, seizures happen without warning. Jerking movements of the body occur and breathing may seem absent. The person can lose control of his bowel or bladder and may vomit. While there are many things that can cause a seizure to occur, the care provided is always the same. Protect the person during the seizure. Move objects away that he may bump into. Do not restrain the person. Allow the seizure to take its course. Do not put anything in the mouth, including your finger. There is no danger of the tongue being swallowed. Activate EMS if the person is injured during the seizure, has no history of seizure, or continues to seize for more than 10 minutes. Most seizures last only a short time and stop without any special treatment. If response and breathing are absent after a seizure stops, begin CPR and get an AED if one is available. Once a seizure stops, it is normal for responsiveness to improve slowly over time. Provide continual reassurance as the person improves. Provide privacy to minimize embarrassment. Continue to monitor until the person returns to normal.
Breathing difficulty or shortness of breath is a medical emergency. It is generally caused by an underlying medical illness such as asthma, allergic reaction, heart failure, or lung disease.
Todd, what's going on? Can't catch my breath.
At rest, normal breathing is regular and effortless. You may first suspect difficulty when there is a noticeable increase in the effort to breathe and the rate at which breaths are occurring. Unusual breathing sounds may occur. A bluish-purple tissue color, especially in the lips or fingers, indicates a developing lack of oxygen and is a serious sign.
No, can you come here? We're gonna get you some help.
Do not wait to see if a person's condition will improve. Activate EMS without delay. If an AED is available, have someone get it. Allow the person to find the most comfortable position in which to breathe. Loosen any tight clothing. Calm, comfort, and reassure the person until another provider or EMS personnel take over. Breathing difficulty can quickly become life-threatening as a person becomes exhausted from the breathing effort. Be prepared to provide CPR and attach an AED if the person's condition worsens. Reassess regularly until another provider or EMS take over.
Asthma or reactive airway disease affects the small air passages in the lungs. Irritants can trigger a reaction that results in narrowed passages due to swelling and the production of mucus. Airflow into and out of the lungs is restricted. Asthma symptoms can vary from mild to life-threatening. Quick relief medications that work fast to control asthma symptoms are available. If the person has a prescribed inhaler for asthma, assist her in using it. If the person does not improve within 15 to 20 minutes, activate EMS. A severe allergic reaction, or anaphylaxis, is an extreme response of the body's immune system to something it is very sensitive to.
I got stung.
Common things that can initiate a severe reaction include bee stings, peanuts, latex, and penicillin. When anaphylaxis occurs, the airway becomes constricted due to swelling of the throat, making it difficult to breathe. Wheezing may be heard. Swelling of the lips, eyelids, and face may occur. Itchy, raised lumps or hives can appear on the face and chest. The person may complain of nausea and abdominal cramping. A reaction can develop rapidly. In general, the faster the reaction occurs, the more severe it is. Without treatment, death can occur within 15 minutes. Activate EMS. Allow the person to find the most comfortable position in which to breathe. Loosen any tight clothing. A person with a history of allergic reactions may carry a prescribed epinephrine autoinjector. Epinephrine can quickly reverse the effects of the reaction and may be life-saving. If the person has an autoinjector available, assist him in using it on himself. Reassess regularly until another provider or EMS personnel take over.
Hey, Don? Hey, Adam, can you come here? Don, what's up? Are you doing okay?
My chest.
Acute coronary syndrome, or ACS, occurs when there is reduced blood flow to the tissues of the heart. Often described as a heart attack, ACS is a serious condition that can result in significant damage to the heart. Someone with ACS will generally experience pain, severe pressure, or discomfort in the chest. Women often do not experience these signs and will describe indigestion, weakness, or fatigue. Shortness of breath, nausea, and lightheadedness can also occur. The person's skin may be pale, cool, and sweaty. A person who has had previous heart problems is at risk for reoccurrence. Ask the person or any bystanders about prior problems or medications being taken. Activate EMS immediately, even if the